Can you show me that?
I can.
Good. Okay.
Let's talk about the aneurysm first.
Okay.
So the aneurysm is an area in a blood vessel wall that's weaker than the normal blood vessel. Because it's weaker, it can start to form a saccular outpouching from the normal blood vessel.
Yeah. Yeah.
And that weak area can rupture.
Yeah. That's what they told me, especially if I take blood thinners. For the other problem, right?
Well, yes, and not even that the blood thinners will make it more likely to rupture, but if it were to rupture with you on blood thinners, it would not stop bleeding.
It would accelerate.
And then by not stopping bleeding, that is life-threatening.
Yeah.
So what we do when we find an aneurysm is we try to decide how likely is it to rupture if we do nothing versus how risky is treatment if we do treat it before it ruptures. Because there's different choices. We can observe an aneurysm with serial imaging, which is the least invasive, but then you are exposed to the natural history risk of rupture for that aneurysm, meaning it could rupture if we do nothing. Sometimes we treat them with open surgery, which is where a neurosurgeon does an incision in the scalp and opens up the bone and puts a clip on the aneurysm from the outside and pinches it shut from the outside. Then the third way that we treat aneurysms is by going through the arteries and navigating a wire up through the arteries into the aneurysm and pushing small pieces of coil into the aneurysm to coil it from the inside. And I'm going to show you a picture of that.
Which one do you like the best?
Well, let's go through everything before I tell you which one. This is an aneurysm right here. It's small on this screen, but this is it blown up. Yeah. This is the normal blood vessel, and this is the saccular outpouching.
Exactly.
That's the weak point in the blood vessel wall. When we go from the inside, we put a wire into the aneurysm, and then we slide a flexible catheter, this gray piece, over the wire. This is like the size of a piece of spaghetti, except it's hollow on the inside.
Yeah.
Then through the inside of it, we push even smaller pieces of metal, really long, thin pieces of platinum, and these are called coils. And they have a predetermined three-dimensional shape that's the same shape as the aneurysm.
Yeah.
Or the same width, the same diameter as the aneurysm. And we push, now we're going to attach the coil. That's what is going on here. This is just a product advertisement, but it gives you a visual of what we do.
Yeah, I don't like that at all.
So we detach the coil.
Yeah.
And we do this with multiple coils until this whole three-dimensional space is full of coils.
Right.
Which is what you see here.
Yeah.
Then we take that catheter out.
Yeah.
Okay, and now you can see when blood flow goes up, this is what it looks like in imaging. This is a cartoon.
Yeah.
Okay, that was all for that one. So that's what coiling is. That's what I do for treatment of aneurysms. Because of your age and because of the location of the aneurysm, coiling is probably a safer route for you to go than open surgery. Because open surgery is has more comorbidities as we get older, and the aneurysm is also deep down in the brain in a location.
You have to go in there like that.
They have to go in from the outside, and it's in a location that's difficult for them to get to with their surgical instruments, and it's an easier location for me to get to with my coils. This is something different, sorry. Let me show you another area. So I wanted to show you.
That's how they did my legs. They went through here, and with a.
He had several stents.
I have a bunch of stents in my.
Yeah, and that's exactly what I do, except I do it all in the brain. And sometimes we require the use of stents to coil aneurysms. This is an example of an aneurysm that I coiled recently. It's on a different blood vessel. See this aneurysm right here coming off the top of this artery? And what we had to do here was we placed two stents. One, this is the distal part of the stent, and this is the proximal part, so from here to here, and then the other one goes from here to here. So they make a Y configuration. We call that a Y configuration.
And what's that square there?
She had an aneurysm years before, and that's from the bone. They had to do a craniotomy and open the brain up, and they clipped another aneurysm that this patient had, but because of the location of this one posteriorly, the second aneurysm was better treated with coiling. And then after we put the stents in, we put coils in the aneurysm, and you can see that's what it looks like after we're done. So it's gone. The risks of the procedure are...
What's the matter, Mom?
Well, my teeth disappeared.
It's right there.
No, this closed one, that's the coffee she brought.
Well,
And this is the extra water you brought. It disappeared.
Okay,
Will
like-
it be on your thing there? That open cup.
can we do this?
Is that my tea?
Yes.
Why did it end up there?
Well, let's just focus on one thing, and let's put, because he's got other patients too.
Okay.
So the risks of the treatment have to do with several different things. Number one, they have to do with the puncture in the leg. You can have bleeding, or you can have infection.
In the leg.